Welcome to Med Madness, where we bring you the latest insights and knowledge in the field of medicine. Today's episode is dedicated to hypertrophic cardiomyopathy, or HCM. Understanding this condition is crucial for medical students and professionals alike, as it is a common inherited cardiomyopathy that can lead to severe complications if not properly managed. In this episode, we'll cover what HCM is, its causes and risk factors, clinical presentation, diagnostic methods, and treatment options. We'll also discuss how to differentiate HCM from similar conditions and conclude with a real-world case study to solidify your understanding. Let's dive in. Next, let's discuss what this condition is. Hypertrophic cardiomyopathy, or HCM, is an inherited condition characterized by the thickening of the heart muscle, particularly the interventricular septum. This thickening can lead to obstruction of blood flow from the left ventricle, known as left ventricular outflow tract, or LVOT obstruction. The condition is primarily caused by genetic mutations affecting the cardiac sarcomere proteins, such as myosin-binding protein C and beta-myosin heavy chain. These mutations are usually inherited in an autosomal dominant pattern. HCM is important to recognize because it can lead to serious complications, including sudden cardiac death, particularly in young athletes. Next, let's talk about the symptoms and clinical presentation. Patients with HCM often present with a range of symptoms, including exertional dyspnea, fatigue, chest pain, lightheadedness, and syncope. The hallmark of HCM is a mid-systolic or crescendo-decrescendo systolic murmur, best heard at the left sternal border or cardiac apex. This murmur increases in intensity with maneuvers that decrease left ventricular blood volume, such as the Valsalva maneuver or standing up quickly. It's essential for clinicians to recognize these signs and symptoms to differentiate HCM from other conditions like aortic stenosis and athlete's heart. Now let's outline the diagnosis. The diagnosis of HCM typically involves a combination of clinical evaluation, electrocardiography, and echocardiography. ECG often shows left ventricular hypertrophy criteria, along with depolarization and repolarization abnormalities such as Q waves and T wave inversions. Echocardiography is crucial for visualizing the asymmetric septal hypertrophy and assessing the presence of LVOT obstruction and left atrial enlargement. Additional diagnostic tools may include genetic testing to identify specific mutations and cardiac MRI for detailed imaging. Next, let's explore how to differentiate HCM from aortic stenosis and athlete's heart. HCM can be distinguished from aortic stenosis by its murmur characteristics, which increase in intensity with decreased preload, unlike the murmur of aortic stenosis. Additionally, HCM patients typically have brisk carotid pulses and lack the ejection click often seen in aortic stenosis. Athlete's heart, on the other hand, presents with LVH without depolarization or repolarization abnormalities and generally normal left atrial size. Differentiating these conditions is vital for appropriate management and treatment. Let's move on to the management and treatment of HCM. Management of HCM involves both medical and surgical interventions. Medically, beta blockers or non-dihydropyridine calcium channel blockers, such as verapamil, are used to increase left ventricular blood volume and reduce symptoms. Patients should avoid dehydration and vasodilators to prevent decreasing left ventricular blood volume. For those at high risk of sudden cardiac death, implantable cardiac defibrillators may be necessary. In severe cases, surgical interventions like septal ablation or myectomy might be considered. Lifestyle modifications, including avoiding strenuous activities and staying hydrated, are also important preventive measures. Let's look at a real-world example. A 17-year-old male presented with exertional dyspnea and a 3/6 systolic murmur that increased with the Valsalva maneuver. His father had a history of sudden cardiac arrest. ECG revealed LVH with lateral T-wave inversions, and echocardiography showed asymmetric septal hypertrophy and dynamic LVOT obstruction. He was diagnosed with HCM and started on beta blockers. An ICD was implanted due to his high-risk profile. With lifestyle modifications and regular follow-up, he has been managing his condition well. In summary, Hypertrophic cardiomyopathy is a critical condition to understand due to its potential for severe complications. Early diagnosis and appropriate management can significantly improve outcomes for patients. Remember, recognizing the clinical signs, utilizing diagnostic tools effectively, and differentiating HCM from similar conditions are key steps in managing this disease. Be sure to engage with our pre- and post-podcast quizzes and use Anki flashcards to reinforce your learning. Thank you for listening to Med Madness, and stay tuned for more insightful episodes.